again this is the image of the embryo, this is the head bulge and here is the cardiac bulge where the development of the heart is occurring. So this is the pharyngeal arch part. So what is happening near this pharynx part, there are the two aorta, ventral aorta and the dorsal aorta. Again I am telling you, you will get better understanding when we will see the development of the heart. There are the two aorta, ventral aorta and the dorsal aorta. The two ventral aorta fuses together and forms the aortic sac, while the two dorsal aorta, they are independent. Okay, so now what is happening? Yes, this is the flow chart for you to remember. In detail I will tell you in the development of the cardiovascular system, but you can prepare the notes. I am telling you what are the facts. Yes, see here, this is the diagrammatic presentation. The development of the heart is occurring and the upper part is making the ventral aorta. Can you compare the ventral aorta part? It is getting fused in making the aortic sac, and on the posterior side there is a dorsal aorta. These are the dorsal aorta. Now try to imagine. Yes, suppose here is the pharynx. This is the pharynx. So the ventral aorta is in the front and the dorsal aorta on the back. Got the point? Now the two ventral aorta, they are getting fused and making the aortic sac, while the dorsal aorta right and left, they are independent. So when you are looking from the front, the ventral aorta are looking one mass, while the dorsal aorta are the two independent structure, and this odd structure in the neck. So what is happening? The ventral aorta and the dorsal aorta, they are connected together with the arch artery. Yes, the first arch artery is running within the first arch, second arch artery is running within the second arch, third arch artery is running within the third arch, fourth and the sixth, so on. Okay, so when you are looking from the front, are you getting the point? Yes, try to think in three dimensionally. Yes, this part is anteriorly, yes, while this part are posteriorly. Getting the point? But because this image is 2D, so you are looking that all the things are in same plane, but actually not. Now see, this ventral aorta and the dorsal aorta, they are connected together with the first arch, second arch, third arch, fourth arch, fifth arch and the sixth arch, right and left both. Again, here is the ventral aorta, on the back side there is a dorsal aorta. So in embryonic phase, these two structures are attached with the first arch artery, second arch artery, third arch artery, fourth arch artery and the sixth arch artery. Now what happens? The first arch artery, you can compare with that flow chart. I am just telling you one time. Okay, the first arch artery disappear, but small remnants is there. Do you remember the first arch was making the part near the mandible? So which artery is running within the mandible? Inferior alveolar artery. So which is the artery of the first arch? Inferior alveolar artery. But if it is not given, then you can mark the maxillary artery also. Now see the second arch artery. Yes, the second arch artery. Do you remember the second arch? It was related with the stapes bone, hyoid bone. So the second arch also disappears. Second arch artery also disappear, but a small remnant is there, that is known as the stapedial artery and the hyoid artery. Now see third arch. Now come to the next arch, third arch. This third arch make the very important structure. The proximal part, it will make the common carotid artery, while the distal part, it forms the internal carotid artery. Yes, this is the common carotid artery, while this part will make the internal carotid artery. Now at the junction of this, both proximal part is forming the common carotid. There is the one new growth. Yes, and this new growth will form the external carotid artery later. So what I am telling you, third arch artery forms the carotid system. Proximal part, common carotid artery, distal part is making the internal carotid artery, while the new growth between that two junction is making the external carotid artery. That's why in our body what happens, it appears that common carotid artery is dividing into the external carotid artery and another artery which is running inside the brain, that is the internal carotid artery. Okay, later again in detail we will discuss in a better way. Yes, now see here the fourth arch artery. Yes, this is the fourth arch artery. Later I will tell you, this fourth arch artery on left side forms the arch of aorta, while on the right side it makes the right subclavian artery, the fourth arch artery, while the fifth arch artery totally disappears. The fifth arch artery totally disappears because the fifth arch totally disappears. Now sixth arch artery, the proximal part of the sixth arch artery, on the both side it will form the pulmonary artery which will supply to the lung, while these distal parts, yes, on the right side it disappear, while on the left side it forms the ductus arteriosus. Yes, on the left side it forms the ductus arteriosus, very important embryological structure, we will correlate with the pediatrics. It will form the ligamentum arteriosum. If it persists, then it gives the congenital heart disease problem, pediatrics correlation, that is known as the patent ductus arteriosus. So this is the brief about the pharyngeal arch artery, but better we will understand in the cardiovascular system development, just for your revision. And I have given one flow chart, one table for you, you can revise from there. So after this pharyngeal arches, nerve, muscular derivative, skeletal derivative and the pharyngeal arch artery, now we are going to talk about the pharyngeal cleft.